Today is the launch of the World Kidney Week. This is an important function on the 13th of March. This Thursday we have the World Kidney Day, but we in Kenya have opted to have a World Kidney Week, which will start from today. We have partnered with Kenya Commercial Bank as well as Novartis Pharma International in this week. The main activity this week is that of screening Kenyans for kidney diseases. We know that kidney diseases in most cases are silent, and you only get to feel that you have a kidney problem by the time it is already late. So knowing early is important.
Then why the focus for this campaign is on, chronic kidney disease and aging?
Yes.
Why the focus on this topic? Why is aging important when it comes to kidney diseases?
Each year we have a different theme as far as kidney diseases are concerned. This year we have opted to specifically target the issue of aging because, first of all, as you get older, the percentage of kidney function slowly decreases. So that by the time you're in your 80s, 90s, it's probably about 60% of what it should be. You're not down because of kidney disease, but because the percentage is low, you're likely to get kidney diseases much more than people with perfectly normal kidneys. Aging also brings in the different risks. One of the major risks is prostatic enlargement in men. With prostatic enlargement, there's blockage of the kidneys, and you can easily go into kidney failure. So the knowledge about such problems then become important. Age also comes to the issues of cancers. An important cancer related to the kidney is cancer of the cervix. Cancer of the cervix causes blockage of the kidneys, and we need to be aware that this is an area that needs to be addressed. The age are also disadvantaged in terms of the costs. When they get kidney failure, they may not be as capable of looking after themselves financially as younger people. So this is an area that we need to highlight so that steps are taken, for example, in insurance and other areas, to make sure that they're well catered for when they develop these complications.
And what is the disease burden like in Kenya when it comes to kidney diseases?
It is major. 10% of Kenyans have some form of kidney disease. That's about 4 million out of the 40 million Kenyans that we are. Out of these, those who are in the final stages of kidney disease who require help are about 1%. The figure is roughly 8,000 patients, new patients per year. Of course, these are patients who, if they're not helped, will not survive. Forms of help they require is dialysis or kidney transplantation. Kidney transplantation is the treatment of choice for these patients if they are transplantable.
Okay, and we have facilities that are enough, for kidney transplants and even for people who want to undergo kidney dialysis.
Yes, we have facilities. Unfortunately, they are very strained, and this World Kidney Week is to urge the nation to address this issue and increase the facilities both for dialysis and kidney transplantation. It is extremely important that we address it, because if you're silent about it, you won't notice it, because patients will just die and you'll say that is mambo ya Mungu. But if you're alert to it, you'll save them and they'll survive. And these are big numbers we're talking about. Okay. Yes, many countries without these services, patients just die and are forgotten. And yet countries, for example, in the Western world, nobody's allowed to just die so easily. And you're given because it is only the kidney which is the problem in many of these patients. So once you sort out that problem, you come back with a perfectly normal person.
Okay. And then in Kenyatta, if you give an example of Kenyatta National Hospital, how many dialysis machines do we have? And they are supposed to serve approximately how many people per day?
We have about 15 machines. The numbers are huge. We have about 300 patients on dialysis.
Daily?
So daily is about 35 patients, which is very high. So we really need about 30 to 40 machines. Fortunately, the board of the Kenyatta National Hospital has agreed to buy machines to reach these numbers. So very soon we'll be having enough machines. But most important is to spread out this service to the rest of the country so that people don't come from Garissa, people don't come from Mandera just for dialysis and go back. It is cruel and really unacceptable that such situations should rise. So the counties, each county should have facilities for dialysis.
Okay. And then what are the signs that people should look out for, so that you can go early, for instance, for checkups to prevent serious kidney infections? What are the signs and what are some of the prevention mechanisms that people can put in place?
Yeah, the signs in kidney disease come in slowly. As I said, the 5 stages we have of kidney disease. The first stage is when you're really normal, but you have some form of kidney disease. Then progressively you go on up stage 2, 3, 4, up to 5, which is now the stage that requires dialysis. So this is a slow process that takes a long time in many of the cases. So early recognition is important, particularly if you've got diseases that predispose to chronic kidney disease, like diabetes, hypertension, inflammation of the kidneys, which we call glomerulonephritis, as well as issues of blockage to the kidney system, as well as inherited diseases. These are the main areas that pose it. So early recognition of these situations is important so that we take steps for prevention of the progression of onto kidney failure. So prevention of progression is extremely important, and that's why early screening and identification is important so that you can be appropriately attended to. And that's why we have the week of screening for kidney diseases that we open to the public.
So who should come? When should you decide to come? Is it something that you should do yearly, or you should do when you start noticing certain queer things with your system?
It's best to do it regularly, probably yearly, as you say. The important thing is that kidney disease affects everybody, right from babies up to the old age. So really everybody should come to check if there is a kidney disease.